disease, kidney disease, lung disease. Again, just about anything you see a doctor for regularly, you would be open to get vaccinated. Also, the people who aren't, quote, frontline, but have been, are still out there and are essential for the functioning of our society. So utility workers, electricians, plumbers. I can tell you, if you need a plumber, they're essential. And my friends and colleagues, the reporters, and all our media people. So that'll open up on the 24th of March. As I said last week, getting a priority to come get vaccinated is a little bit of a hunting license. It doesn't mean you're going to bag a deer just right away because there's only so many appointment slots. Our vaccine allocations here in North Carolina are starting to increase, but just starting now to increase. And by the end of the month, I'm really optimistic that we'll have at least maybe up to even close 10 times the supply that we have now. So there should be a lot more appointment slots available as people get vassal at getting vaccine out. Where would you be able to get a vaccine? Right now, it's still usually through vaccination centers. Individual physicians, unless they have special vaccine provider licenses given from the state, wouldn't be doing it. So you're looking at major health systems, county health departments, special vaccine events that you might see announced, including from us here at Wake Forest Baptist Health, and also through Novant, and working with the county. You might have an event at a place of faith, such as a church or synagogue or mosque, or you might have an event that might occur in a gymnasium somewhere. So keep an eye out on your community calendars and your community events for these events that come up. Wake Forest Baptist Health, we're also having a mobile unit now that will go out for vaccinating. Can't give quite as many vaccines with that, but what we can do is get to areas that are underserved by healthcare. And we can get out to the people who can't get to us or can't get to a vaccine center so easily. One group of people is the infirm elderly who have a hard time leaving their house. And so we're trying to get out and actually give vaccine to the people in their homes for this group of people. So as more vaccine becomes available, this is something more you're going to see. Johnson & Johnson vaccine starting to come out this week, was approved last weekend. I know we talked a little bit about it last week. I'll go over that again in case you missed last week's broadcast. Johnson & Johnson vaccine is a adenovirus vectored vaccine, so we use a replication incompetent, non-disease causing virus, and that has some DNA in it that encodes the spike protein for COVID-19 virus, and then that produces the protein in your body. And then your body makes the antibodies against it. The antibodies latch on to COVID should you become infected and neutralize it. That vaccine is safe. The safety data is incredibly robust, actually, with a little bit less soreness and a little bit less fever and fatigue than the messenger RNA vaccines. Also, the vaccine is only one dose, so the immunity occurs after only one dose. And we don't have to keep it in these ultra-cold freezers, so it makes it a little easier for us to get it out to some of these events like we're talking about. The vaccine is extremely protective against bad outcomes from COVID, such as death or hospitalization or ICU stay, just like the Moderna and the Pfizer vaccines. And also, there's some data that it works against variants, including the South African and the Brazil variant, which is real good news. It's some of those variants might, if they start circulating, which the UK probably will, if it isn't already, that vaccine will work against it. And it also has some data that looks at preventing transmission, which means asymptomatic infection. Have you been vaccinated? You're much less likely to give that vaccine to somebody else. So it slows the virus down and its progression through the community. All those things are things that all three vaccines do. And so if you're offered one of these three, take it. Take the one you can get the quickest, and that's my advice. And I personally would be comfortable getting any of the three, without hesitation. One other thing about vaccination that's come up, and people don't know about so much, that sometimes when you get these vaccines, you get lymph node swelling. What's a lymph node? That's what sometimes you call glands, like when you get a sore throat and your lymph nodes swollen, you say, yeah, I've got some swollen glands. And it's not uncommon to get with infection. And actually, lymph nodes swell sometimes after vaccines because the lymph node is where all that immune stuff is going on and revving up the antibody responses. So one thing about these vaccines, when we give them, sometimes they cause swollen lymph nodes in the armpit. And if one of the things that we look for when we do mammograms is looking for swollen lymph nodes in and around the armpit, because that's one of the things that come up with breast cancer. So we've noticed that some people who've been within 4 weeks or so of getting vaccinated, their mammogram report comes back abnormal. And that is concerning to people, rightfully so. But it doesn't mean anything because it's actually just picking up the vaccine lymph nodes that are doing their job and making your immune antibodies. So if you're scheduling a mammogram, make sure you schedule it either before your vaccine or at least 4 weeks afterwards. That also comes up if you, for some reason, feel a lymph node in your neck and you go to your doctor and they say, maybe we should get that biopsied. The doctor and you should think about, well, maybe that came from the shot and we can wait 4 weeks and see if it goes down again and save yourself a biopsy. So just a couple things about the lymph nodes with the vaccine. Other than that, follow on safety data from the messenger RNA vaccines that we've had, because there's been, 50 million doses, something like that, maybe a little bit more given in the United States now. And about 1 in a million people will have an allergic reaction from it, which is a little bit more than a flu shot, but not much. Other than that, we haven't seen any safety signals at all. So far so good. I'm really encouraged, very optimistic about our vaccines and our vaccination programs. With that, one other thing I wanted to go back on. Last week, we talked about, what can I do, what should I do now that I've been vaccinated? So I have a few follow-up notes from that. The one is that I'm getting a lot of emails from people who I'm just getting the feeling that they kind of think that the pandemic is basically over, or at least over for them. And it's not. So right now, we probably, for instance, in the Triad area, have around 20 to 25% who've become immune from natural infection. Here in Forsyth County, about 15.5% have gotten their first dose of vaccine. So we're nowhere near yet herd immunity, and what herd immunity is what's going to need to prevent virus transmission in the community so that any single person in the community is protected because of the immunity of the herd. So we got a ways to go with that yet. And I'm just getting a feeling that as spring comes along, people want to shed the mask and relieve the inhibitions and restrictions and just go back totally to normal. And we can't do that yet. I'm disappointed, and I don't mind saying, with Texas and Mississippi. I think that releasing their mask mandates and opening up 100% is not the right idea at all. And I can tell you they will have problems from that because their vaccine rates aren't any higher than ours. In fact, they may not be quite as high. Here in North Carolina, I think our approach is fairly sound, and to slowly ease back things. Last week, the governor opened up particularly restaurants and bars so that they can stay open later. And as long as people behave responsibly with that, and continue to avoid crowded spaces, particularly crowded spaces that aren't ventilated, we may be okay with that. But we just can't forget that we're still in a pandemic. We're still going to need to mask, and we'll probably need to mask for some time yet. Probably until Christmas time of next year at least. Some areas we may be masking longer than that. In fact, there's discussions about requiring masks on airplanes forever because of the viruses that can get transmitted. If you ever sat next to a snotty-nosed guy sneezing on the plane, you know what I'm talking about. It's probably good to keep that contained. But we're also going to need to avoid large gatherings, and particularly larger gatherings that are indoors. So as we start getting into thinking about graduations for schools and high schools, I think that a lot of these are still going to be virtual, or if they are in some sort of a hybrid situation so that a smaller number of people can go, but not large groups of families. And we're still going to need to be careful with bubble fusions. Last week we talked about how to ease up a little bit on bubble fusions. So if you're going to rent a house at the beach and you've been vaccinated and Grammy and Grandpa have been vaccinated, you get you guys all together. But try to limit the number of bubbles that come together, even this summer with vacationing, to people you feel really secure about in your pod. One other thing I talked about last week that I thought a lot about it afterwards, and still thinking about it, but because Danny had asked, can I hug my parents who've already had both of their shots? And I think my response yet last week was kind of cautionary, that maybe you may not want to think about it. But I can tell you, Danny, if you've been vaccinated and your parents have been vaccinated, go ahead and hug your parents. You might want to still wear your masks, but it's a risk. The risk and reward you have to balance, and sometimes the rewards you get from hugging loved ones are worth it. If you haven't been vaccinated, then at least hand sanitize and wear your mask when you hug your parents, and don't linger in the hug. But I felt a little bit like maybe I was a little harsh on that one last week, so I thought I'd bring it up again this time. And so really that's all that I have on the docket for this morning's briefing. You all here have any questions? Yes, Eric.
The federal government is opening a mass vaccination site next week and everything. Is it here? Or?
Yeah, so it was asked about the federal government's opening up a mass vaccination site. Yes, I'm glad you brought that up because I should have mentioned that. Yeah, FEMA's going to be opening up a site. The North Carolina site will be in Greensboro. And they'll be opening up next week. I don't have the details yet on how the appointment system will work for them or how they're going to do it, but look for the press releases on that to be coming out soon. And that's helpful. The more vaccines and the more vaccine sites, the better off we all are. So that's just another place one can get vaccinated. At some point we may actually be able to start giving some vaccines in doctors' offices, particularly the one-shot Johnson & Johnson vaccine, because the refrigeration requirements aren't such. So some places I think might start doing that a little bit. Right now there's just not enough of that vaccine to distribute it out yet.
How important do you think it would be to have that many? I mean, I don't even know how many people are going to be able to take it one time.
Yeah, I don't know exactly what the capacity is going to be for the FEMA, the federal government site. We'll have to wait and see how that. The federal information on that is a little bit vague because I think each site's going to have a different size and different numbers of vaccines. But the important thing for us in North Carolina is the vaccine allocation to those federal sites is going to come straight from the federal government. And so it doesn't have to come out of our state vaccine supply. So it's over and above, and that's good.
Press release I have says they can administer 3,000 vaccinations a day.
So I just updated, it can be maybe 3,000 vaccinations a day, yeah. So I know, you know, for instance, at the Forsyth County site that we do, once we get the vaccine allocation and the full allocations we get, that's actually what we anticipate there as well. It's 3,000 a day. So it's a lot of shots and a lot of arms. So that's good. All right. See